As of the making of this video, there are 1,330,461 cases of the COVID-19, best known as the coronavirus, around the world. And although there have been roughly 73,870 deaths, there have also been more than 270,000 recovery cases. So, if you have not been infected by the COVID-19, you might be interested in finding out what happens to your body after catching the virus. Today, we will be talking about the effects of the coronavirus on your body after infection. Don't forget to subscribe to our channel and ring the bell. Just a quick reminder to clear up any possible confusion. The COVID-19 spreads primarily through droplets generated when an infected person coughs or sneezes, or through droplets of saliva or discharge from the nose. To protect yourself, clean your hands frequently with an alcohol-based hand rub or wash them with soap and water. Wearing face masks not always ensures protection from transmission, but most likely will prevent you from transmitting the virus to others if you're infected yourself. So, let's begin with the first symptom. After being infected by a disease, you might start feeling standard symptoms such as a fever or cough. Some viruses in particular might have a longer incubation time, so you might be presenting symptoms several days or even weeks after being infected. More accurately, it takes about 5 to 6 days for someone to show symptoms after becoming infected. However, some people who carry the virus remain asymptomatic, meaning they do not show any symptoms. This is why, even if you're not showing any symptoms, make sure to wash your hands constantly and avoid social exposure to prevent infecting someone else. Now, examine some background on the virus. The COVID-19 belongs to a family of viruses called coronaviruses, which range from the common cold to even more dangerous and mortal respiratory diseases, many of them even deadlier than the COVID-19 that has the world under lockdown. Some of these are the Severe Acute Respiratory Syndrome, or SARS, and the Middle East Respiratory Syndrome, MERS. Now, let's move on with the technical stuff. When a standard virus infects your body, it enters your healthy cells and makes copies of itself, multiplying throughout your body. It has been found that the COVID-19 has a spiky surface with which it latches onto healthy cells, especially those of your lungs. The viral proteins of the COVID-19 bust into the cells, hijacks them, and takes command. Yep, kind of like an invasion in medieval times. Of course, some of the unluckier healthy cells will die in the process. The COVID-19 is much more severe than the flu, though it certainly has a much lower mortality rate than its older cousins. Anyway, infection should not be taken lightly, and the correct safety procedures should be followed at every chance. The COVID-19 is more likely to go deeper than the common cold, and probably at this point your lungs will become inflamed, and breathing will become much tougher. Eventually, this could lead to pneumonia. For those unacquainted with the exact effects of pneumonia, it's an infection of the alveoli, which are the tiny air sacs inside your lungs where blood exchanges oxygen and carbon dioxide. For most people, the COVID-19 symptoms will end with a cough and a fever, and most cases, as you've probably seen in the news, are mild. However, the infection can get more severe for some after a few days. In some cases, after about 5 to 8 days after symptoms begin, you might experience shortness of breath and acute respiratory distress syndrome can begin. ARDS, as this is called, includes rapid breathing, a fast heart rate, dizziness, and sweating. This is when things start getting bad, and most of the vulnerable population can die at this point. ARDS will damage the tissues and blood vessels in your alveoli, causing debris to collect inside them. This makes it harder or even impossible for you to breathe. Since fluid will begin collecting in your lungs, they will carry much less oxygen to your blood, which at this point may not supply your organs with enough oxygen to survive. This is when things start getting much worse. This can cause your kidneys, lungs, and liver to shut down and stop working. Of course, remember that not all cases of COVID-19 evolve into ARDS and may simply remain in the common cold symptoms, such as cough or sneezing. At this stage, make sure to follow the recommended safety protocols to not spread infection and possibly endanger other people to the COVID-19. Some people who have COVID-19 have also reported other types of symptoms. For example, a third of cases has reported the loss of smell or taste, and 15 to 3% has reported pink eye or conjunctivitis. The virus can cause a loss of appetite, nausea, diarrhea, and indigestion. You may have these symptoms before fever or any respiratory problems. The COVID-19 can also lead to liver problems or even damage. Once more, remember that most of these symptoms can start and end in the coughing and sneezing, sometimes coupled with a fever, and not all people have reported diarrhea, conjunctivitis, or loss of senses. Also, don't forget that the recovery for mild cases is approximately 2 weeks and is 3 to 6 weeks for patients with severe or critical disease. If you have presented any of these symptoms or are feeling unwell recently, make sure to consult your country's or local community's protocol regarding safety and try to enforce social distancing as best as possible. So what do you think of these symptoms? Do you know anybody who has experienced them before? Let us know in the comments. If you enjoyed our video about the effects of coronavirus in your body, make sure to give it a like, share with your friends, and also subscribe to our channel for more great content like today's video. And remember, stay safe and healthy.
Listen!